Hello guys, welcome back to my channel. We were discussing about the ECG series. In previous lecture we have discussed the T wave and the abnormalities of the T wave, in which we have discussed the first abnormality, which is the T wave inversion. Today we are going to discuss the other three abnormalities, which are number one is the tall T wave, then we will discuss the second one, which is the small T wave, and the last one, which is the biphasic T wave. So today we will be discussing about these abnormalities. So coming towards today's topic, which is tall T wave. Tall T wave will be noticed when the amplitude of T wave will be greater than 5 mm or greater than 10 mm in height when seen on a ECG paper. Then you will say that the T wave is not normal. It is the abnormal condition. So the causes we will be discussing today are, number one, here is the hyperkalemia. The second condition here is the hyperacute MI, and the third one is the acute true posterior MI. In all these conditions, you will notice the tall T wave. So in order to differentiate between these, hyperkalemia is the condition in which you will notice that the level of potassium will be greater than 5.5 milliaqueous per liter. So it is seen usually in end stage renal diseases. So in hyperkalemia, you will see that the differences between the hyperkalemia and hyperacute MI, in both conditions you will notice the tall T wave, but the differences here are, number one is the tall T wave will be seen in hyperkalemia and the wave will be tented and narrow. The second thing here is the symmetrical T wave. The third thing here is the QT short. The QT interval will be short in hyperkalemia. But here in hyperacute MI, you will notice that the T wave will be broad and it will not be tented. The second thing here is the asymmetrical T wave, and the QT will be prolonged. So this is how you will differentiate between these two conditions, like hyperkalemia and hyperacute MI. In acute true posterior wall MI, you will also notice the tall T wave in V1, lead V1 and V6. V1 to V6, you will notice the tall T waves. Then comes the second abnormality, but before that there is another cause of this tall T wave, which is Prinzmetal angina, in which you will notice the tall T wave. But in order to differentiate between Prinzmetal angina and hyperacute MI or myocardial infarction, in myocardial infarction, the ECG which will be taken is the serial ECG. In serial ECG, you will see the tall T wave, but after that you will also see the appearance of Q wave, and there will be raised enzymes or raised cardiac biomarkers. But in Prinzmetal angina, which is vasospastic angina, you will notice that there will be tall T wave, but this tall T wave will come towards the normal, or will be coming towards the normal position, and we also no Q wave seen in the Prinzmetal angina. And the last thing here is the cardio biomarkers, which will also be not raised. So this is how you will differentiate between hyperacute MI and Prinzmetal angina. Then comes the second abnormality, which is the small T wave, which is seen in hypokalemia and hypothyroidism. And the third one condition here is the pleural effusion. The third abnormality of the T wave is the biphasic T wave. You will notice this in the hypokalemia and myocardial ischemia. But how will you differentiate between these two in biphasic T wave? So basically, what is biphasic T wave? This biphasic T wave means this is the isoelectric line. The T wave first part will be below this isoelectric line, and the second part will be above this isoelectric line. So the wave will be biphasic. Now, what are the conditions in which you will see the biphasic T wave? Number one here is the hypokalemia, and the second is the myocardial ischemia. So what are the differences in the ECG that will make that the condition is hypokalemic or there is a myocardial ischemia? In hypokalemia, you will notice the biphasic T wave will be down going first and up going second. The second part will be upgoing. While in myocardial ischemia, you will notice the first part will be upgoing and the second part will be downgoing. So this is how you will see the biphasic T wave in both these conditions. So today we have also discussed the other abnormalities of T wave like tall T wave, small T wave and biphasic T wave. In the next video we will be discussing about the QRS complex, which is a major complex of the ECG segment. So stay tuned and do subscribe my channel for the next video. Hope you like my video. Thank you very much for watching. I'll see you in my next video.